Hello, and thank you so much for tuning in today. I have a special guest with me, Adria Thompson. Adria is a speech and language pathologist acclaimed for her work in dementia care. She's the driving force behind Be Light Care Consulting, known for her innovative micro learning videos that cater to a broad audience of over 310,000 followers across social media. Adria's approach is deeply rooted in evidence-based research, ensuring high-quality care and education for both personal and professional caregivers. On today's episode, we talk about memory and cognitive changes in multiple sclerosis and tips on how you can improve your brain health. Adria, thank you so much for joining me today.
Thanks so much for having me. I know we've been talking for a while, so I'm excited to finally connect.
I know, me too. For our listeners, we were just talking before this, and I'm pretty sure Adria and I have been trying to set up this conversation for around a year or so. So it's really exciting that we are finally able to connect and share your expertise with the world. Before we dive in, do you mind if I ask you a question from my interview deck?
Yeah, let's do it.
Awesome. Okay. I don't have many questions left, which means I've had at least 50 guests within this last year, which is crazy. Okay, your question is, who is the best female role model in your life?
Ooh, that's a good question. Okay, the first person that comes into mind for me is Teepa Snow. So if you are familiar with Teepa, she is an occupational therapist who specializes in dementia care. And for the past, I think over 40 years now, she has been teaching and educating the public about dementia and coming up with more dignified ways to care for people with dementia. And so I think she's been my role model, like professionally, for so long. And I had a chance to meet her last year, and she didn't disappoint. She's as amazing in person as she is, online and everything. So yeah, Teepa is a really inspiring person for me.
That's awesome. I did see on social media, because that's actually where we first met, that you were at a speech and language conference. Is that where you met her?
Actually, I went to one of her conferences. So she has her own conference, and it was, yeah, probably over a year ago now. And she invited me to come and hang out with all the people who are certified under her. And we were able to do a dancing TikTok together. So that was really fun. She's a
Oh
good
my gosh,
sport.
that's awesome. Very cool. All right, so let's go ahead and dive in. And I think let's start off super basic. So you are a speech and language pathologist, and we're going to be talking mostly about cognition and dementia, but can you explain first and foremost what is a speech and language pathologist, and then how does cognition work into that? Because speech and language, people mostly think mouth and talking and swallowing and voice, not necessarily mind and memory. So can you give us some details on that?
Sure. A speech language pathologist is the same thing as a speech therapist. So that's one thing I want to clarify from the beginning. I use those terms interchangeably, but our technical term is speech language pathologist, or SLP, but we provide speech therapy services. So a speech therapist helps people from birth to death. So I actually received speech therapy as a child for our articulation disorder, which we are very familiar with, I think, as a society, of speech therapists helping kids talk or say their R's or S's. And that's the kind of therapy I was given when I was younger. And that's the kind of therapy I thought I wanted to do when I got into this field. But beyond working with kids in a school system like that, there's a lot more we do. So we help people in three main areas, and that would be communication, swallowing, and cognition. Communication is not just speaking, it's also understanding. So there's expressive and receptive language, and all of that falls under communication. So whether someone's having difficulty understanding what they hear or expressing themselves, either verbally in writing or with body language, we help with that. The second is swallowing. And so from pediatrics, like in the NICU, who are having a hard time latching or feeding, all the way to the end of life where individuals might have difficulty swallowing or getting choked. Speech language pathologists are the experts that diagnose and treat those disorders. And sometimes that involves modifying food or liquids and doing lots of exercises. The last piece, which is what we'll talk about a lot today, like you said, is cognition. And cognition is basically just thinking skills and anything the brain does that helps us function through our day. And so communication and cognition are closely linked. You might also be aware that occupational therapists help with cognition as well. And so that is one area that there's an overlap in what we do. But as speech therapists, we focus on cognition as it relates to communication. So if we have difficulty with attention or memory or problem solving, that affects the way that we interact with other people and the way that we communicate. So I'm sure we'll dive into that, but that's kind of the overall gist.
Nice. Yeah, that's a really great summarization of that. So I guess one thing I'm curious about is how did you become more interested in that cognition piece? Because you do primarily focus on dementia. What made you go in that direction?
Yeah. So I alluded to the fact that I thought I wanted to work with kids, and really all the way through undergrad and grad school, I really wanted to work with children and specifically with severe disabilities that required what we call AAC, or augmentative alternative communication devices. And that might look like a picture book that they point to express their needs, or something more high tech like a tablet or something where it talks for them. And that was really like my passion, what that I thought. But after graduating from grad school, I got an offer to work in a nursing home. And honestly, the pay was really good. And I was like, I can do this for a while before I find, really what I want to dive into. And what was quickly revealed to me was not necessarily that it was kids that I loved, but I loved working with people who others had just completely written off. People who we underestimate, that aren't able to advocate for themselves, that were so challenging or complex that they were just not provided either the services that they deserve or the care that they deserve. And so that really translated for me when I was working in nursing homes, realizing that in adults and older adults, that is often individuals with dementia, right? Like we think that people are, the phrase too far gone, or like they're not able to express themselves well, and so they're not given the care that they need. People don't understand them. And so that's really where my heart lies, is just with any population like that. And so over the past 10 years being an SLP, I just really drew more towards, like my heart was just drawn towards people with dementia. And actually 5 years into being an SLP, my grandmother was diagnosed with dementia. So I started seeing it from a personal point of view, which just lit that fire under me even more on her behalf to continue specializing in this area and advocating.
I love that. That's so amazing. I feel like that's such a wholesome view of, these people don't have anyone really in their corner, or maybe not the right people. And so you can be that person for them. That's so great. So can you share a bit about, and this might be a really loaded question, but dementia and or just memory loss, is there differences there? And is there a difference between someone experiencing memory loss who has MS versus dementia versus any other diagnosis?
Yeah, that's a great question. I know your audience and your specialty is multiple sclerosis. And so somebody might listen to me talking about dementia and think, well, this isn't going to be relevant, but it will be. So hang with me. So dementia, basically, to define it, there's two criteria that you have to fall under to be diagnosed with dementia. It's a very simple term, and it's really not a disease or a specific diagnosis. It's actually just like a condition. So dementia says that a person has changes in their ability to think. And the second thing is that it's affecting their everyday life. So typically dementia happens for people who are older, but not all the time. It can happen in someone's 40s or 50s, but it's a change in your ability to think that affects your everyday life. And if you meet those two criteria, there's a chance that you could receive a diagnosis of dementia. Now, there are very specific diagnoses that fall under dementia. We might hear the term Alzheimer's disease. That's the most common diagnosis. It falls under the dementia umbrella. We also might hear frontotemporal dementia, vascular dementia, Lewy body dementia, and the list goes on. There's actually hundreds of types of dementia. Those are the most common though. But for someone with dementia, when we say a change in thinking, often we assume that everyone with dementia has memory loss. And that's actually not true. It might, especially at the beginning stages. So to give you an example specifically, in individuals with frontotemporal dementia and Lewy body dementia, their first symptoms that they demonstrate, and even years into having this diagnosis, they might not have any problems with their memory. It's actually like just thinking and cognitive skills in general. So that is one thing that a lot of people misunderstand, is that it is a memory disorder, but it's actually just a thinking disorder. So I think I've read like 50% of individuals with MS will experience some cognitive changes. Like they might not have cognitive changes that are so severe that it affects their ability to get dressed in the morning or to care for themselves. But any kind of change is concerning. It is frustrating, obviously. And so, as far as I'm aware, most people who do experience cognitive changes with MS will experience some memory changes. They might also experience some attention changes, so having difficulty focusing, concentrating, really attending to whatever task that they're doing. They also will have some problems with information processing, whether that look like problem solving or taking lots of information, consolidating it, and making an action plan and moving forward with things. So there are a lot of changes that individuals with MS can experience as far as cognition goes that would look similar to some people with dementia.
I never thought to differentiate it in that way, and thinking that it's more of a thinking diagnosis versus a memory. I just assumed all dementia is affecting your memory in some way, shape, or form, but that's not true, is what you're saying.
Yeah, it's not. And that's why, so I'll give you two examples that your followers, your listeners will definitely recognize. But just recently, we've heard about Bruce Willis having a type of dementia called frontotemporal dementia. And his first symptom was difficulty with language. And that falls in line with that kind of dementia. So he likely was not experiencing any memory changes when he first started feeling symptoms. Now, as someone has any kind of dementia, like the longer they have it, it will start to, it's progressive, it's a progressive disease. So it'll start spreading to other parts of the brain, and eventually they will experience some memory changes, down the road. But as far as, the very first kind of symptoms that you experience, frontotemporal dementia isn't memory loss. Also, we know that Robin Williams ended his life a few years ago. And it wasn't until after he died that when they did an autopsy, they saw that he had Lewy body dementia. And he went completely undiagnosed while he was alive. He had access to the best doctors. He went to all the psychologists and neurologists, and they couldn't appropriately diagnose him. He thought he was just going crazy. He was experiencing visual hallucinations, sleep disturbances, and fluctuations, and being confused and being really lucid. And those are the three biggest symptoms for Lewy body dementia. It should have been a no-brainer that he got diagnosed, but unfortunately, it's not well understood. Yeah, he made an unfortunate decision to end his life because he just thought, my beautiful brain is broken. And so many people with types of dementia that don't impact memory get misdiagnosed or not diagnosed at all.
Wow. I actually don't know if I knew that about Robin Williams. I don't know if I heard that. That's crazy. So if someone listening is thinking, okay, yeah, I am starting to notice some of these changes, whether it's memory or thinking or language, what is the first thing that they should do? Should they seek out a speech and language pathologist? Should they do something on their own? What would your advice be there?
My first advice would be to just go to your general doctor and get a once-over, get a full checkup, because there are some things that we actually call pseudo-dementia or reversible dementia, which are conditions that mimic dementia or these cognitive changes that can be reversed or can be fixed. So some examples would be a thyroid disorder that goes untreated, menopause sometimes, right? Infections like a urinary tract infection, vitamin deficiencies, or like having high ammonia levels that can cause confusion. So there are some things, even like a brain tumor, right? So there could be things that could be treated that can cause memory and thinking changes that need to be addressed. So first of all, just going to your doctor, getting blood work, getting a head to toe checkup, they could find something that's easily fixable. That's going to be the first thing you do. Now, if you have MS, then there is a chance that you do all those tests, everything comes back normal, and they tell you, well, this could be associated with the MS that you have because cognitive changes can happen. Now, in that case, I do recommend pursuing some speech therapy potentially. Occupational therapy would also be a great option. But honestly, it shouldn't be, and it's really not up to you to decide what kind of service you need. Just ask for it, and those professionals can come in and assess you and determine who would be the best to provide services. Because there's absolutely things that we can do. It's not just a lost cause, oh well, like I'm doomed to just be forgetful for the rest of my life. There's things that we can do that be proactive.
I love hearing that because so often I think when it comes to memory and thinking, it for some reason is one of those things that we just think, well, all right, hands up, nothing we can do here. And we just assume, okay, it's progressive, it's going to get worse or it's not going to get better. So that's really great to hear that there are things, and it might be that pseudo version. I will say, I feel like there have been times in my life, like different phases, where I just can't remember things, or like even if I've just had like a really busy day and I'm giving a presentation at the very end of my day, I can't think of the right word that I'm looking for, and I'm just literally scratching my head like, what am I trying to find here? And I can't find the words. How will we know if you have MS or a different diagnosis? Is there a way to tell what could be disease related versus something else that's much more mild and more normal?
Yeah, I think that maybe not so much as like something that's MS related versus not MS related, but I can tell you what's concerning and not concerning. So that could be a good place to start. So if you are experiencing changes in yourself and you are feeling those frustrations, and what you describe is you're reaching your cognitive reserve for the day, right? So we all have, like, I'm sure many of your listeners, or perhaps you have heard of the spoon theory. So the spoon theory basically is an analogy of like the cognitive or physical energy that you have to get throughout your day. If it were represented in the number of spoons you have, let's say you have 32 spoons, when you're living with a chronic condition like MS, cognitively and physically, it requires more energy to do things that you used to do without thinking about it, right? So before, if it took one spoon to take a shower, that physical or cognitive energy, now it might take 3 of your spoons to take a shower because it's more taxing on you. And so what happens is when we have days that are cognitively taxing for us, we run out of spoons at 4 o'clock, and there's no chance that we're going to make dinner. There's no chance that we're going to be able to be patient with our kids or our spouse, and so we just break down at the end of the day. That is common. Like, that's true for anyone with or without a neurological condition. It's just that people with neurological or chronic conditions get there sooner. So to be concerned, I would say if other people start to notice changes that you have been experiencing. So there's actually a scale. It's called the Global Deterioration Scale, and it's used to determine the stages of dementia. So it takes someone's progression through dementia and puts it on a number scale from 1 to 7. 1 being normal cognition, 1 being no problems at all, and 7 being the most severe it could potentially get. Now, in those numbers, stage 1, like I said, is normal. Stage 2 is what we call age-associated normal aging memory changes. So it is normal to have changes in thinking and changes in memory as you get older. It will happen. But the definition here is that you notice changes in yourself, but other people don't. And if you were to be given a comprehensive neurological assessment, they're not going to pick up on anything. A lot of people who have experienced COVID cognitive changes kind of fall into that category where they're like, no, there's something wrong with me, I can tell, but there's no proof or evidence of it when tests are given. And that's a very frustrating place to be. It's not to say that if you're in stage 2, like, get over it. It definitely does feel hard, but just know that you're not in a danger zone. The danger zone comes in stage 3, where we consider, it's called mild cognitive impairment. And so that's where other people are starting to notice. And this is the point where instrumental activities of daily living can become difficult. And things that fall under that category are the more complex tasks like budgeting, like paying bills, like medication management, like driving, cooking. So where you're having to do multiple things or manage multiple items at a time, there's a lot of cognitive processes happening during that task. Once you get into that stage where those things are becoming difficult and you're having to ask for help and other people are noticing, that's really where we need to start seeking some help. Now, stage 4, right after that, is where we dip into a diagnosis of dementia. That's where we start having difficulty with ADLs, where it's like caring for ourselves. Those instrumental activities of daily living, which were more complex things, are completely impossible for them now. So that's kind of where we dip into being concerned and needing to pursue some help.
So initially, if you are thinking that you're experiencing some of these things, you can go to your doctor first. They can do some tests, see if you do need a referral or not. And if so, they might send you to a speech pathologist or a therapist or occupational therapist. But something else that you mentioned too is that you can do things on your own. What tips do you have if someone's noticing these changes? Maybe they're stage 2, maybe 1 or 2, or maybe even 3. Are there any things that they can do on their own to help themselves out of it?
So this is where the 5 pillars of brain health come into play. So there are 5 main areas that research has showed us as improves our brain health. And this is not just for people that are starting to notice changes. These are for teenagers, like for any person. Like, we need to be thoughtful and mindful and really care for our brain health as much as possible. So these principles are definitely important for people who are noticing changes, but anyone needs to consider these 5 areas. So the 5 areas, number 1, we'll start with physical movement and exercise, right? Gretchen, I know you would definitely encourage that, right? So moving your body is good for your brain. And that doesn't even necessarily mean you have to run a marathon, even if it's just getting up and moving throughout your day a little more than you would. Go for a walk. Any kind of physical movement is going to be important here. The second thing is diet. So there are a lot of diets out there, diet plans and recommendations. The one that we've seen that's best for the brain is called the MIND diet. So this is a combination between the Mediterranean diet and the DASH diet, which is what's recommended for heart health. And the rule is, if something's good for your heart, it's good for your brain. So I encourage anyone to kind of look up the MIND diet. I can't get into all the specifics here, but it's going to be heavy, low sugar, no processed foods, but also things like fish, omega-3s, antioxidants, things like that. Moving on from there is building cognitive reserve by cognitive stimulation. So if we are constantly receiving some cognitive stimulation, it's going to make our mind sharper. Now, a lot of times we might think of doing crossword puzzles or word searches, and that's great if you don't typically do those. But if you do a word search every single day for the past 40 years, it's not really stimulating yourself cognitively in a way that's going to grow neurons, right? We're not going to be building or learning something new by doing something that we've done every day. So really, cognitive stimulation and building that cognitive reserve is going to be doing things that are new experiences, learning a new language, even going to a new place, when you're driving, taking a different route, just changing things up for yourself a little bit can be cognitively stimulating. The fourth is actually socialization. So research shows that isolation and withdrawal and being alone is really bad for our brain. A lot of that is having social support, but also it's communicating and interacting with others, which is also a form of cognitive stimulation, right? When you're meeting new people and you're interacting with others, you're having to be on your toes. And so socialization is a big thing. And the last is just managing what health conditions you have well. So if you should be taking medication, you need to continue taking the medication, and just making sure that we stay up to date with health check-ins with doctors and making sure that there's nothing in our body that are those reversible conditions that can take over and really kind of wreak havoc.
I am learning so much just from this conversation. When you said that one of those steps would be cognitive stimulation, it almost sounds at first like, well, that sounds wrong. Like, I want to preserve my cognition. I want
Mm.
to, I want to rest my brain, not stimulate it. But that does make sense of stimulating it in new ways.
Yeah.
My father-in-law has been doing crossword puzzles, like that exact situation, as you've mentioned, for, I don't know, 20, 30 years. So I'm going to now suggest to him that maybe he try something else.
Yeah. Yeah. Sudoku, change it up a little.
Right.
But
Yeah.
that's the thing is like we think that like these like workbooks and puzzles and stuff are the only way to or downloading apps that are supposed to be good for our brain. Like maybe yeah, that could be good, but also just living your life a little differently. That's the thing about when we age and retire, sometimes our routines get so set. We do the same thing. We go to the same places. We talk to the same people. And that's where we have such a lack of cognitive stimulation that can be detrimental.
And I just want to throw a plug in here because if you're not following Adria, and I will put her Instagram in the show notes, you have so many tips and strategies that are so simple to implement just into your normal life. They're nothing crazy, but it's things that a lot of us don't even think about. So if you're not following her, or if this is the first time you're hearing of her, definitely check that out. But I have a question about advocacy. How important is it to advocate for yourself, especially if maybe you are in that phase 1 or 2 where no one else is really noticing yet? I feel like with MS in general, sometimes you're advocating for yourself more than you'd like, especially if your MRIs don't show any new lesions, but you have new symptoms. What if that's kind of the case here where there's no new lesions? Doctors are saying, nope, there's no reason that you'd be experiencing difficulty thinking of the right word or XYZ. How do you advocate? And do you find that you do need to? Is that a common thing?
Yeah, see, we wish like it would be so much easier if function, like our change in function was always evident with some kind of test and blood work or imaging, but that's not necessarily reflected. We might look at the brain and think that everything's fine, but their function is different. And maybe in 50 years from now, that might change. We might be able to see the brain in a different way and see more specific details. But as it stands today, that is a common problem for people across all conditions, is that there's not always evidence of the things that you're describing. And so it's absolutely important to advocate. Important not only to advocate to the physicians that you have in your life, but also be aware when you might need to make changes with the people who are providing care to you, the medical providers that you've chosen. I was talking to my husband's grandmother about this just this weekend, where I think a lot of times, like especially in the generation that's aging right now, there is a level of respect that they give physicians and loyalty that's like, what they say goes. And if they say that I'm fine, then I'm fine. Like, I don't want to push anything. I don't want to hurt their feelings. I don't want to get them in trouble. And really, it's important to know for anyone that you are the boss of your own care. You are the one to make decisions on your behalf. And if that means that sometimes we might need to seek out a second opinion or to find someone else who will listen to us, it's really important to do that. And I think younger generations are kind of finding that, discovering that a little bit quicker. But it's really important to know that if a medical provider, whether it's a doctor or a therapist or someone, is not serving you or listening to you, then it's okay to go somewhere else or to ask another person for their opinion. Gretchen and I, we are medical providers. I'm not going to get my feelings hurt. It's a good time for reflection for medical providers, and that's really necessary, if you're losing patients because of that. But I always encourage people to seek out, because the same issues happen with dementia, where people will see very obvious changes and they go to their doctor and they say, well, you're just getting older. It's like, no, that's not what research says. First of all, that's not normal aging, but also I need some resources here.
Right. Do you know what the laws are for speech pathology? Like, I know for physical therapy, when it comes to telehealth, like if someone's listening to this conversation right now and they're thinking, well, I don't know who to go to, or, there's no speech pathologist near me. With physical therapy, you can only treat people via telehealth who live in the same state that you're licensed in. Is that the same for speech, or can you cross borders? How does that work?
Largely, yes, that's true. There's been some movement recently where we have like interstate licenses right now where they're really trying to pass that. So, very in some states, and hopefully very soon, those laws might change. But it is best to kind of just start in your local area, and if you don't have those providers in your area, to branch out some. It's going to probably be easier to find someone in your state for those licensing issues. But telehealth is alive and well in speech therapy, and it's a great resource for people who have cognitive changes.
Yeah, especially cognitive and mobility is words that's coming to my mind, but what I really mean is like transportation. I feel like a lot of people that I have worked with who have had some type of cognitive limitation in some way might be living alone, or they don't drive, or they need to find someone to drive them. And so telehealth can just increase that accessibility too, which is nice.
Absolutely.
So, can you share the places where people can find you? Because hopefully, this podcast has opened so many people's eyes, but I know this podcast is definitely going to get people thinking a bit more. And I have a following where they like to do as many things as they can as possible to manage their health now, not wait to get to a certain point. So, where can we find you? Where can we find all your tips and lovely expertise and advice?
Yeah, thanks for asking. So, my name, like I said, is Adria Thompson, and my business is Be Light Care Consulting. So, you can find me, my website is belightcare.com, but you can find hundreds of videos that I have made about dementia, but also just cognition changes in general on any social media platform, specifically Instagram, Facebook, and TikTok at Be Light Care. And all of those videos, all of that content is free. It's a treasure trove of information. I also have one course out. It's about how to shower someone with dementia, but there'll be more courses in the coming months for some of those more challenging parts of care. So yeah, I appreciate so much you letting me share that. I love talking about dementia. I also do consultations. So if you're listening and you're caring for someone with dementia, you can always reach out at my website and do a one-on-one consultation so I can help you figure out how to get care done a little bit easier.
Awesome. Thank you so much. And I will put, for everyone listening, I'm going to put all of those in the show notes so you didn't need to memorize the website or any of those accounts. I will link those there. And I'm glad that you also mentioned something that you can help people care for those that are having dementia. I don't know if we call them episodes or, memory loss or thinking, whatever it is. There, you really focus on both groups. There's so many tips that you have for yourself, but also if you're living with someone who is going through everything that we talked about, which I think is so helpful because it's very different if it's yourself versus someone else.
Yeah, and I think that, the education that both of us do is really about just setting the proper expectations, right? So whether it's knowing what to expect with MS or to identify, oh, this thing that I'm experiencing is a thing that happens, right? Like just hearing that is so relieving, but also it prepares you. So when you start to experience something new, if you've heard it from Gretchen, you're like, oh, okay. Now, not only do I know what this is, but I know how to deal with it. And that's the same kind of thing that I provide on my channel about dementia is if you don't have someone with dementia in your life, you will, unfortunately. It touches everyone's life eventually, and you're going to be much better off if you know what to expect than if you're just completely blindsided. So come on over. I'd love to have you.
Absolutely. And again, I'll share all those links for everyone too, so that it'll be easy to access you. But thank you so much. Again, I've been waiting a year for this opportunity. I'm so excited that we were finally able to connect and truly just share your expertise in such an easy to understand way. So thank you so much for being here.
Absolutely. Thanks so much for having me. We'll have to do it again sometime.
Absolutely.